Welcome to today's video about 8 warning symptoms of stroke in men detected quickly. Did you know that young men have a higher risk of stroke? Every year, about 370,000 men in the United States experience a stroke, which is one of the main causes of mortality and disability in this age group. And the risk can be even higher for men under 44, with rates exceeding those of women in the same age group. Today you'll learn how to recognize the symptoms of a stroke in males and how to act promptly to seek medical care. A stroke is a medical emergency that requires quick attention. And don't be fooled, stroke isn't simply an issue for the elderly. While women have a much bigger lifetime risk of stroke, current studies demonstrate that men, particularly younger ones, have an elevated risk, especially for hemorrhagic stroke. Furthermore, males between the ages of 40 and 80 are more likely to suffer an ischemic stroke. Although symptoms might be similar in men and women, there are some essential differences to be made, particularly in terms of focused symptoms such as slurred speech, dizziness, and paresis. Identifying the symptoms of a stroke can save lives regardless of gender. In this video, we'll look at 8 warning symptoms of a stroke in men and explain how to recognize them quickly. Stay tuned until the end because one of these warning signs could be a lifesaver. Symptom 1. Facial paralysis. Let's start with one of the most evident indicators of a stroke, facial paralysis. It manifests as abrupt numbness or paralysis on one side of the face. To be sure, conduct a simple test. Ask the individual to smile. If the smile is asymmetrical, with one half of the face immobilized and the other moving regularly, raise an alert. This paralysis can affect the eyelid, causing it to droop and make it difficult to close the eye, as well as the corner of the mouth, resulting in drooling. Another significant element is the lack of feeling in the face. The person may not feel touch or have tingling on the affected side. 2. Loss of arm movement. Imagine trying to lift your arm and having it feel heavy or disconnected. An abrupt loss of strength or numbness in one arm is another classic indication of a stroke. Aside from weakness, additional signs of movement loss may include tingling, trouble completing simple actions, such as picking up an object or buttoning a shirt, and a lack of coordination. Remember that loss of mobility in the arm can develop gradually or suddenly, and the intensity varies. However, any symptom of weakness or trouble moving should be taken carefully and reported to a doctor as soon as possible. 3. Paralysis on one side of the body. Speaking of paralysis, this sensation is not limited to the face. It can also affect the body. A stroke usually causes paralysis on only one side of the body. This paralysis can affect a single limb, like the arm we just talked about, or an entire side of the body, including the arm and leg. The intensity can also vary. Some people completely lose sensation and movement, while others retain some muscle function. The duration is also variable, and it can be temporary or permanent depending on the severity of the stroke and the damage to the nerves and muscles. 4. Confusion or difficulty speaking. As we mentioned earlier in the video, one of the main differences in stroke symptoms in men are the focal ones, mainly related to concentration and speech. A stroke can cause sudden confusion and disorientation. You may have difficulty understanding what others are saying or feel disoriented, not knowing where you are or what you're doing. When you try to speak, your words may come out differently. How you sound may surprise you, or you may not realize that you're speaking incoherently. If you try to repeat what you were saying, making an effort to pronounce correctly or form a sentence, you may not be able to. Difficulty articulating words is a common early sign of a stroke. If you or someone else is confused, slurring their speech, or having difficulty expressing themselves and understanding what is being said, ask simple questions to assess the clarity and coherence of the responses. This difficulty communicating can be a crucial sign of a stroke. 5. Vision problems. Many transient issues and medical conditions can cause vision problems. However, when a stroke is to blame, parts of the brain that control vision are affected. The individual may experience blurred vision, double vision, or dark spots in one or both eyes. Others lose half of their visual field in each eye. Complete vision loss, which may be temporary, is also possible. You may try to focus on an object and see it double or blurry, for example. You may also see everything black, completely or partially, as if the lights were out, which may feel like a curtain is coming down in front of your eye. Therefore, any sudden change, such as blurred vision, double vision, or partial or total loss of vision, requires immediate medical attention. 6. Dizziness, loss of balance, or difficulty walking. The sensation of instability, difficulty walking in a straight line, or unexplained falls can indicate a stroke. When the brain can't communicate properly with the appropriate parts of the body, the eyes, ears, joints, and muscles don't work cohesively. A person in the early stages of a stroke may feel unbalanced, lack simple coordination, or be unable to perform basic physical activities. Dizziness that leads to loss of consciousness is especially dangerous. Individuals experiencing this symptom may feel confused and disoriented. Not only can this potentially precede a stroke, but it can also cause dangerous falls or other accidents. Before we discuss the final symptoms, don't forget to give this video a like, subscribe to the channel, and activate notifications so you will never miss out on our upcoming videos. 7. Severe and sudden headache. Although it may appear typical, anyone who experiences severe headaches on a regular basis should contact a doctor. You may experience discomfort in a specific area of your head, or it may be widespread. While this is not true for all strokes, a certain sort of headache can be a warning sign of an upcoming stroke. In a 2020 research of 550 individuals, 15% experienced a sentinel headache before having an ischemic stroke. A sentinel headache is one that appears before an occurrence, especially within 1 week of a stroke in this case. The study's authors stated that these headaches were severe or unlike any previous headaches. Furthermore, these headaches developed within 7 days of the stroke and frequently persisted until additional stroke symptoms appeared. It was also shown that people who had a sentinel headache before a stroke were more likely to have atrial fibrillation, a kind of arrhythmia, than participants in the control group who did not have a stroke. Any unexpected or severe headache should be taken seriously since it may indicate a more serious health problem. 8. Difficulty swallowing. Swallowing, a seemingly easy and instinctive action, can become a challenging task after a stroke. Dysphagia, or difficulty swallowing, develops when a stroke impairs the brain parts responsible for this vital function. In healthy people, unintentional choking causes a strong cough, a defensive reaction that clears the airways. However, with a stroke, this reaction may be sluggish or weak, allowing food or liquids into the lungs. This aspiration can cause major consequences such as pneumonia and, in the worst-case scenario, death. As a result, if you or someone close to you has frequent choking and difficulties swallowing saliva or food, don't ignore these symptoms. They may be a quiet signal that the brain is in danger and need immediate medical intervention. How can you quickly recognize these stroke symptoms? Recognizing the symptoms is crucial for saving lives, and for this reason, the American Stroke Association has developed an easy-to-remember strategy. If you suspect that you or someone nearby might be experiencing a stroke, remember to act fast. Face. Smile or ask the person to smile. If the smile shows a droop on one side, it could be a sign of a stroke. Arms. Raise both arms or ask the person to do so. Does one arm drift downward? Speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? Time. If you notice any of these symptoms, call emergency services immediately by calling 911. The faster treatment begins, the greater the chances of recovery, and the lesser the potential for lasting damage. But now that you know the symptoms and how to act, the question arises, what puts men at risk of stroke? Several factors can increase the risk of stroke in men, including high blood pressure, diabetes, smoking, obesity, high cholesterol, family history of stroke, and heart disease. High blood pressure is a major risk factor for stroke, but nearly 1 in 3 men with high blood pressure don't even know they have it. Smoking is also a major villain, as it damages blood vessels and can lead to a stroke. Men are more prone to smoking compared to women. Being overweight or obese is another significant risk factor. Nearly 3 out of 4 American men are in weight ranges that increase their likelihood of having a stroke. Additionally, more men than women are diagnosed with diabetes, a condition that can lead to diseases in the blood vessels of the brain and, consequently, increase the risk of stroke. Excessive alcohol consumption also raises this risk, with men being more likely to drink excessively compared to women. Finally, a sedentary lifestyle contributes to the increased risk of stroke. Only 1 in 4 men gets enough physical activity, even though just 30 minutes of exercise a day can significantly reduce this risk. And remember, 80% of strokes can be prevented. So, when it comes to staying healthy, prevention is always the best way. How to prevent a stroke in men. In addition to being aware of the risk factors, there are some habits that can help reduce the chances of developing a stroke. These actions include engaging in regular physical activity. Physical activity reduces the chances of having a stroke and prevents various other diseases and health problems. It's no wonder this is one of the main medical recommendations. Having a healthy diet and controlling weight. The diet should be varied and balanced. It's not just about eating the same foods every day, but about combining them properly. Be creative when preparing meals and stay away from ultra-processed and fatty foods. We've prepared a video here on the channel about 6 foods to prevent stroke and recover from stroke, so be sure to check it out. Not smoking. Smoking is one of the leading causes of stroke and is considered the #1 enemy of health. Maintaining control of blood pressure, cholesterol, and glucose is also crucial. Therefore, regular doctor visits and health monitoring are essential. After all, prevention is always better than cure. Do you know someone who has already experienced a stroke? If so, leave your comment below and share this video with all your friends and family. After all, when we care, we share. If you found this information helpful, don't forget to like and subscribe to our channel. Hit the notification bell so you won't miss any future content. Before you leave, we invite you to watch 2 more recommended videos related to stroke popping up on your screen right now that I'm sure you will enjoy. Thank you so much for watching. Stay healthy and until next time, bye.